So before doing this procedure, so I'm going to be doing the urinary bladder, the bladder scan assessment. Before doing this procedure, I'd make sure that I would be in proper uniform attire, so scrubs, hair pulled back, my name tag, and I would also make sure that the bladder scanner was disinfected before and ready for use before going into the patient's room. So I'm just going to go ahead and just knock on the patient's door. I'd announce myself. Hi, my name's Acacia. I'm going to be your student nurse for today. I would go ahead and provide for privacy. Maybe I should go this side. I'd make sure to pull the curtain, check for privacy. Go ahead and perform hand hygiene. I would then go ahead and explain to the patient what I'm going to do. So, sir, how are you doing today? I'm going to be doing a urinary bladder scanner on you, just to see how much urine you have in your bladder. I understand that it's been painful for you you've been having trouble avoiding. So I want to put the patient's bed at least waist level or above, just a comfortable working position. So now that I've explained the procedure, I would want to first, I would identify the patient, and I would look at both arm bracelets, or at both hands to see where the arm bracelet is. And it's here. Sir, could you please state your first name and date of birth? Thank you. And I could also identify the patient by the hospital identification number as well. Sir, do you have any pain or allergies today? Your pain being 0 amount of pain, 10 being the most amount of pain. So if you said you didn't have any pain, I would go ahead and document that. So first things first, I would go ahead and I'm going to give the patient as much privacy as possible, but I'm going to have to expose their abdomen area. So as part of my first initial assessment, I would go ahead and make sure to put on gloves. And just by the naked eye, I would want to make sure for any wounds/lesions, if the patient is distended at all, because if they have not been able to void, sometimes there could be some swelling. And I could also listen. I would want to make sure I auscultated a minute in each quadrant of the bowel before palpating, just to make sure that I don't cause any damage to any of the intestines or anything like that. And then now that I've auscultated, I would also want to note if normal bowel sounds are present, so 5 to 35 gurgles per minute. But I would also want to make sure, so now that I've auscultated, I can go ahead and palpate. I would ask the patient, sir, do you feel any pain as I touch lightly? And if you did know any pain, I would want to know where, and then if it was 0 to 10. So now that I've done that, I'm going to go ahead and get my bladder scanner ready. And I can go ahead and side rail down. I would first want to go ahead and turn on my bladder scanner. It seems like it's not charged today, so ideally, I would wait for a sound to appear to know that it's on. So I would go ahead and turn it on, and then I would want to explain to the patient, sir, I'm going to go ahead and use this gel to put on your lower abdomen area. Might be a little bit cold. If for any reason it was too cold for the patient, I could warm it up and make it comfortable for him. So I'd go ahead and put some gel down in his lower abdomen. And now that that's on, I want to choose the gender on the bladder scanner. So I'd go ahead and choose the gender. so I would choose male. If I was doing a bladder scan on a female who had a hysterectomy, I would use the male option as well. So whenever using the bladder scanner, I want to do it about 1 inch above the symphysis pubis, which is right about here, and I want to point down towards the coccyx. So I'd go ahead, I have my gel on, and so I'm going to go ahead and I'm going to go ahead and start scanning. And I would use the machine to guide where to scan, and usually it would tell me when it was complete. So if once it was complete, ideally, if we are going to put a catheter inside a patient, it would usually be more than 200 mils. So I could say that I had a recording of 220 milliliters of urine. So I would want to go ahead and disinfect this, and then I would put it back, and I could use my tissues right here to wipe any excess gel off the patient, and I would dispose of that. If there was still any gel left on the patient, I'd make sure to remove it completely. I then put the gown back down, ask the patient if, "Sir, how did you think that procedure went? Are you in any pain?" And if he said no, then I would just go ahead and make necessary documentations. I would want to make sure to put the patient's bed back down into lowest position. So that's about right there. And I would want to put the cyro back up, call line in place, and then that would be the end of my procedure, and I would make sure to make any necessary documentation, dispose of my gloves, and also disinfect my equipment, and then